Okay, so imagine yourself to be outside a communication station. Okay, and your scenario is you are a ST3 trainee in a DGH, and you've been asked to speak with Chloe, who is 14 years of age, who has had paracetamol overdose and has had taken no, what do you say? The levels were really high and had to be given NAC, and is asking that she wants to go, basically get discharged. Okay, so she has a lot of self harm marks on her forearm. So, and you need to explain that she can't leave the hospital at the moment because she needs to be evaluated by a CAMS team. Yeah. So she's awaiting discharge. So she wants to leave, basically, and you need to speak to her.
She's awaiting discharge, meaning she's been treated for.
She's what do you say? Medically, she is fit for discharge. It's just a psychological evaluation.
Right. Got it.
Yeah. Okay. So we can start the timer.
Yeah.
Yeah. Okay. So you have 4 minutes preparation time. Okay. Aisha and Myra, have you prescribed to pass test? Clinical videos? Clinical examination?
Yes.
Yes.
And yeah, have you seen this scenario?
Yeah, I
No,
think so.
not. This was not in the past tense, is it?
It is asked in one of the exams, and it is.
Yeah,
it is
I know about this scenario, and actually, yeah, it's good that you're doing it now, so we'll get some guidance because I was also confused about this scenario.
Okay.
Yeah. Yeah.
Okay. So yeah, so if you're ready, just let us know. Then
Yeah. Okay. Let's start.
you're ready, yeah? Okay.
Yeah.
Okay, so I'll just reset the timer. Okay, so you can now.
Sorry. Just before we start, any of these kind of scenarios or even a clinical question for our future sessions and classes, when for the candidate who's sitting on the hot seat, it's a different. I mean, they are obviously preparing and they are thinking through their mind process and head. But I'm sure you guys must also be doing. But try to make it a habit that if you were on the hot seat and you were in the exam scenario, what points would you be gathering, and try to write that down on yourself. So it could be it can be a kind of mental exercise for you towards preparing the station.
In this 4 minutes, right?
I have a question here.
Okay.
Sorry. Yeah, the question is that in this scenario, so the registrar is supposed to talk to the 14-year-old child or the parents about
Right.
the CAMS referral?
Child. There is no parent. The child is making a fuss that she wants to go. Okay. But you need to let the child know that at the moment we can't discharge her without a CAMS evaluation. Parent is not there.
Okay.
So this will be only the actors could be a teenage student as well by themselves.
Okay. In presence of parents or without?
No, many times in my Edinburgh exam, there was only one teenage child. She was sitting in front of me. There was no one along with her.
Okay.
And many stations, it's just a teenage kid as the actor. And sometimes they act very sassy. They've been asked to act really like a proper teenager, and they act really weird in front of us. Yeah.
Okay.
Yeah, if you go wrong, they start crying as well, and then
Yeah. That's it. They can literally make things difficult for you.
Okay.
Okay, so Harshada, give it a try.
Yeah.
You can now enter your room, enter the station.
Yeah. Hi, Chloe. I'm Dr. Hashida. I'm one of the pediatric registrars. That is a children's doctor here. How are you doing today?
I'm good. I'm okay.
Yeah. So we've done all your tests and we have sort of given medically treated you and you're on your way home. But just before discharge, we'd like you to meet the CAMS team. And
What team? I didn't actually I didn't get it.
yeah, so we have seen that you're medically fit to go home. But
Yeah.
just because we were admitted here for an overdose, we would like to also make sure that the mental health is taken care of. And we would suggest that you meet the CAMS team and we can organize this at the hospital. They will have a little chat with you and see what's going on and help you with the mental health issues.
So are they doctors as well?
They are a team of professionals who, yes, they are doctors as well.
Okay, and so what basically are they gonna do to me?
So, Chloe, we're just going to get into the root cause of why all this happened. And I understand it must have been a very difficult situation for you. And we'd like to know what's really bothering you and how we can help you and support you. And so that
Um,
doesn't repeat, this is not repeated again.
yeah. Fine. Yeah. Whatever. Yeah. That's okay. So when are they? And can it be done like an outpatient service? Because I badly want to go home now.
Unfortunately, Chloe, we can't do this remotely or virtually. It has to be done one-on-one.
So,
Uh,
or is it like another hospital? I could go there, because you're telling me that I'm medically fit. So why can't I? I can go with my parent or with my dad to that place.
Unfortunately, Chloe, we can't discharge you unless the CAMS team have seen you and they have given a go-ahead for the discharge.
The thing is, I've been sitting here. I was told, my last medication finished a day ago, and it's a weekend, and the so-called team, whatever mental team, they haven't shown up yet. So it's very frustrating. And my cannula's out, and why am I, why aren't they not coming? Because are it's not like it's a hospital, so there should be professionals who should come in on when you're dealing with sick children. Why are they not here yet?
I am really sorry about this inconvenience, Chloe. I will try to make it as quick as possible. I'm really sorry for the inconvenience. I will speak to the CAMS team myself. Is there any concern regarding the weekend? Is there anything that you need to attend to that you need to attend to during the weekend?
Yeah, because because I'm not happy with the family dynamics, and I just want to be with my friends. I
Mm-hmm.
have plans. It's summer, so I just want to go out with them. Because
Mm-hmm.
and
Yeah,
and it's very frustrating to be caged in a hospital. I'm a really jovial person. I need to hang around. Sometimes I need to go hang around, do a fag. So I just I'm not finding it easy here.
I can completely understand. It's been difficult for you, Chloe, and I understand it's not an easy place to be in and to get admitted and going through all these needles and stuff. I am really sorry for the delay from the CAMS team. I'll try to organize this as soon as possible. I'll speak to the team myself and get this done quickly. Is that okay?
Yeah, that's fine because I basically would want this to because I've come to know a friend of mine who was in a similar situation, and they had follow up in communities. 'Cause they would come to my house.
Mm-hmm.
So why can't you organize something of that sort? I just am finding it really hard.
See, Chloe, the camps team will speak to you. They'll have a little chat
Mm.
and see what's happening, what's really bothering you. They will try to provide as much support as possible from our end.
If
It may be
if
medical
if they're
treatment.
yeah,
Sorry.
if they're doctors as well, I mean, you guys are doctors as well. Why don't you guys, ask me a few questions and then send me home? Why does it need to be them?
So these are specialist doctors and they're professionals and they deal with mental health issues. I understand you must have gone through a terrible time and which brought you to this situation. So they are the experts in this and they'd like to make sure that you go home safe and there are no red flags and that this episode is not repeated again and this is for your own safety and to just make sure that everything is in order. Does it make sense?
Yeah, because I don't want to reveal about myself to many professionals. I just want to be kept things quite confidential.
Mhm.
So I'm finding it really awkward to speak with different professionals and letting them know about my past and what all has happened with me. Because
Mhm.
there's been hard things which has happened, and that's the basic reason why my mood is always low. And yeah, so I just don't want will my parents come to know?
We can arrange for a one-on-one with the CAMS team, and if you do not want your parents, we'll make sure that they are not there while the CAMS team is assessing you,
Yeah.
and um, they'll make sure that it's going to be one person who's going to come and speak to you, and not many people. If that's what you want, we definitely can organize that for you.
And what about what about my school? I don't want any of my friends to know what has happened with me. So can you? I just don't want anyone in school to know as well.
Um, I can understand it's a very difficult situation for you. And being in your situation, I can completely understand wanting to be with your friends, but not wanting them to know. I can completely understand where you're coming from. But we will have to involve the school at some point. And it may not be your friends, but the school will have to be involved at some point in time.
Why don't you just give me some medications and let me go, like any antidepressants or something? Because I'm just this is basically killing me from inside. I just don't because not it's just I'm not happy with this.
Unfortunately, we are not the doctors who can prescribe antidepressants if need be.
Mhm.
They are the ones who would first listen to you and come to a diagnosis. And if required, they will prescribe the correct medication, the correct doses, and a correct follow-up.
Okay.
And and when they feel it's right to discharge you, they will come up with a plan.
And in any way, can I speak to someone if I am in any sort of a need? Because many times I feel I need to speak to someone.
Yeah, of course. So the CAMS team will provide a lot of support, and there are also hotlines which you can speak to uh, if you ever feel the need to. But the CAMS team per se will provide you with a lot of uh, support in terms of medications, in terms of one-on-one, in terms of follow-up, and there is a 24-hour line which you can access as well.
Okay, so your time's up. Okay, so
This was
how,
great.
how was it?
It was bad.
It was pretty okay. I felt like you did really well. What about others? What do you think? Myra, do you want to say something?
Yeah. Yeah, I think it was good. It was good. I think where he was asking for somebody to support, I think social worker, we could
Uh,
have involved in this one. I
mm,
mean, Camp could have discussed about having a social worker for him if he really wants to, further
yeah,
discuss things with.
yeah, yeah.
So, and in your conversation, somebody told me that, even I can't, I can't even change myself on this. I was told that to use this phrase, I can understand quite a many times, is not, preferable. Just maybe we can
Mm.
try adding up sentences like, I can't even imagine what you're going through. I mean, I can understand is considered a negative statement, um, because we can't actually be in their situation and we can't understand. So I was actually given this feedback. That's why I'm also giving you, Harshita. Maybe it helps you somewhere.
Yeah, sure, thanks.
I
Yeah,
mean, rather than saying it 5 times, you could say one time, then another time.
Yeah, people were laughing on me that I was saying it like 6, 7 times.
But as a general rule in these kind of situation, can you just give me the out? Can you guys just provide an outline of how would you be approaching what points you would be addressing, and how would you be going about not going into the exact nitty gritty of the conversation, but an outline like how broad points of what you need to do in this kind of scenario in this kind of conversations.
Okay, so
So you
I
have a
think,
teenager
yeah.
who is wanting to leave the hospital, who is wanting to go, is
Hmm.
getting a bit impatient, and your task is to explain that they need to wait longer. So how
Hmm.
what do you think is your expected out of you, and how would you do? What's the outline of your
I think
conversation?
Harshita covered everything. What I could have done, like, was same. Ask him why he wants to go home. What's the dynamics? Is he having any commitment at home with his friends over the weekend? And
That's
why
good.
can't he stay? What is making him, going home so
Yeah. So
without
yeah.
completing the whole thing?
So what you're doing is exploring the concern. So that is one point. That is one
And
of the
how
outline.
can we help him, with that? I mean, how can we quickly, how can we quickly close the process so that he can go home and enjoy with, like, do whatever he wants to do? So she
There
also
are
So
offered
so
that.
there
Yeah.
are options in the hospital to entertain children. Okay, so even in DGH there are specific rooms for teenage rooms. You might have seen, like they have what do I say?
games room,
Yeah,
playroom.
games room, PlayStation, to take their mind off, books to read. So you could just say about that many times. Yeah,
what if you
deep,
just
deep,
said
deep.
you wanted to go and fag? So what do we? How do you respond to that?
That they will literally tell you like that. Okay, they will literally say they want to do vape.
Huh.
So, so you will have to say, unfortunately, we this is being a hospital, it's not allowed. You can say about nicotine gum for the time being or something like that.
No,
Yeah,
but I mean, in technicality, if they are, they can be escorted out in the presence
yeah,
of a
yeah,
nursing staff or
yeah,
a healthcare
yeah,
staff, and they do go out and they do fag and they come back.
yeah. Or offer
Even
a
14
nicotine
year
gum.
olds are allowed, huh? Okay.
Yeah, I've seen many teenagers doing
Yeah,
this, unless and until it's medically contraindicated for them with some poisoning. But if it's not, then they
yeah,
go out for their time and they fag and come back. So that's not
yeah,
something you would like to contest in your conversation. But yeah, so first point is essentially you are exploring the concerns, you are addressing that concern, and then when you brought out the point of CAMS assessment, I think you lacked in explaining what exactly CAMS was, and
yeah.
you were kind of
Going around.
hiding
Yeah.
away from bringing out that it's a mental health assessment of
Yes.
children and adolescent.
So
So
you could instead of saying CAMS, you could say CAMS is basically an abbreviation of Children and Adolescent Mental Health Services, like that. You understand?
Yeah.
Yeah.
can you guys see my screen?
Yeah.
Yeah, so this is the marking criteria for the communication station. So if we just have a look at this information sharing and gathering, I would probably just mark somewhere between borderline or below standard, because some inaccuracy, irrelevance of information was there. Provided information provided was lacking in structure, and you have not checked the understanding of that patient. So no verification of understanding.
Yeah, this is very important. What
This is
Raisbai said, verification of understanding. See, towards the end of the conversation, you can kill time by saying, do you basically has what this session what we had? Do you basically have you understood what we have said? Do you want me to summarize what we all talked about for this session? You can ask her. Okay, so sometimes they said they will tell you, okay, yeah, or you can, or you can ask them, do you want to summarize what we just had, what we discussed, or
Yeah,
what we,
and
yeah,
and that's kind of common to a lot of for all the communication station.
all
And then
communication
come,
station,
yeah,
end your communication station by summarizing. Either you summarize, or you can ask the person who is to
to
summarize.
some, yeah.
With that, they will give you verifies understanding and summarizes. See, meet
Mhm.
standards, A2, 3 marks,
So
point three.
this is 2 marks, this is 1 marks, and this is
Yeah,
0 marks.
0 marks. Yeah.
So yeah, and the communication skill rapport, they were, I would say, they were minor issues with level of confidence, but I mean, I understand it's a night time,
Yeah.
so but try to be more
accurate.
sounding more
Mm,
confident in terms of what you're relaying the information, that as if you know what you're talking about. It seemed
mm.
here that when you were trying to hide away the cams, what are cams actually a mental health assessment, because the moment you say that it's a mental health
Yeah.
assessment, you will be challenged, you will be contested by the by that teenager, that what do you think, I'm mad or what, or you
Mm.
do I need to be why do I need to be assessed, and you have to get your points ready to how to counter that.
Points like we can give, okay, that you had these paracetamol, I mean
So
you had this overdose, which is like something that is worrying you, something is there that is worrying you, and that's why you did this. So this is just for the
I
assessment of that.
I basically have written down a few things about this. So I'll just read about it, okay?
Okay.
So basically, you say, Chloe, we have clinically treated you now, and you are safe. You're clinically safe. Your medical treatment is basically finished. I understand that you need to go home, but the we need to psychologically assess you and do a risk assessment. That is why we're not being able to send you home at the moment. Okay, it's a psychological risk assessment. That is why we are keeping you inpatient. Okay, then, Chloe, have you heard of CAMS? Okay, so you say, or she'll say, what's CAMS? So you tell them it's an abbreviation for so and so, Children, Adolescent Mental Health Services. Okay, so you can say they do a lot of beneficial things. Okay, unfortunately, you going home today is decided by the CAMS team. Okay, then you can say, do you want your parents to be with you in this situation? You want your parents to be with you when I'm telling you about, to asking really telling you about what mental health and things like that are. Okay, this is a very sensitive subject to these English these teenagers who have done this, right? So um, since a very sensitive subject, it's always better to bring someone to be with them. Do you want someone to be with you? Okay, because we don't know, this child would have gone through a lot of abuse, or is getting bullied, or getting cyber bullied online, or the child has been abused in many ways. So their mindset is very fragile. Okay, so if basically if it's a male doctor examining, speaking with a teenage female Chloe, it's always better to ask for a chaperone, or do you want someone else to be with you? Yeah. And then or you want, do you want me to call your mom, or do you want your parents to know about this? So they will say, no, I don't. Then you can answer, she'll say, no, I don't want my parents to know. Okay, you need to understand, this teenager can be really agitated sometimes, and can speak really harsh to you. Okay, I was very easy very easy with Harshada, but sometimes, do you think, like how Raisbai said, what do you think, I'm mad? Okay, you don't know what I've been through. So you guys, so they can be very harsh with you as well. So you basically, it's better to say that, do you want someone to be with you? Okay, then I've written, I think it's better we involve your parents, because they need your support in this as much as they need to support you as well. The parents will be shocked to know their child has overdosed, right? So it's better for their benefit. It's beneficial for parent and the child. Okay, and then you can say cam's team will speak to you, and they have their own methods, like family support methods. Okay, they will involve your family to know why this has happened, and I think it's important that we involve your parents, if not now or in a later stage. Okay. Then you can ask, are you worried if your parents come to know? And then they will tell you, what do you say? The child will tell you if he wants the parents to know or not. Then you can tell them that, we all are always there with you. Okay, it's not just me. The nurses are there with you, and that we can try to arrange, what do you say, involve other professionals to help you out, like medical professionals like GP, nurses, and community nurses, CAMS, community services. Okay, and we can always be there for you. And if you have any, if you have any difficulties at school, we can, there's something called pastoral support team in every school. PASTORAL, pastoral support services. These are CAM, like psychological support for children in school. Okay, so you should be open to them that these children are very volatile. They have tried to suicide, right? They have parasuicidal ideations. So you can, what do you say, so tell them that it's not only in the hospital that you will have support. There are other professionals in the community as well. So one is this good thing which I found is the pastoral support team. In every school has it. Okay, so you can say about that. Then I have jotted down. Um, but if you want no one in the school to know, we can arrange for that as well. Okay. Then they will check you why. Yeah, the CAMS team basically will come in. So the child might ask, why is CAMS going to come in? What basically are they going to do? So you can say they are professionals who, unlike me, expertise in mental health. So they will come in and check you why you got admitted and what difficulties that led to you, what were the difficulties that led you, what is it, led you into this admission, what basically made you think of suicide. Okay, and ask you what was the event that basically prompted you to end up doing this. Okay, and they will give you options, and they will involve your parents and see if there's they will inquire about the family dynamics and help you out with things in your family, and provide you with a cognitive behavioral therapy. Okay, and then you can introduce that there are websites nowadays. There are websites. I can signpost you certain, what do you say, psychotherapy, psychological support websites or apps on the phone. That Then the community team, once the CAMS, it's not just one assessment. They will keep you in follow up in the community. So they will assess you very often for the next coming few months. Okay, hello.
Yeah, hello.
Yeah. So, and the CAMs will respect your privacy. They will keep things confidential for you, so you don't have to worry about them. And they will always be there as a support for you, one on one. You can approach them whenever you want. Okay, so they should feel like there's always someone who will be there. So like there is school. I told you about the school pastoral team, right? There is school counseling as well. There'll be a community counselor. So there are many professionals who's always there at your service. Okay, so I even asked why do if you're a doctor, why do I need a CAMS doctor? Why can't you assess me and send me home? So you have to say, unfortunately, I don't expertise in mental health, and these professionals who come from the CAMS team, they are the ones who expertise in this field, and they are really good at it. And they have many modalities of treatment, and they will basically dig deep and understand what basically is bothering you, and they have their own services in the community, and so and so and so like that. Okay. Um,
Just a question about
Hello.
the school. Hello.
Sorry. Yeah.
Yeah. She says that I don't want the school to know, but I think at some point the school will be involved because the school has to provide reports and things, isn't it?
Yeah, so that was fine. But what do you say?
But here she said she didn't want her friends to be involved, and that is you that confidentiality can be maintained by not allowing the peer groups to know. The school
Yeah,
management, it's not an
we'll have
issue. Even yeah, I mean that's not something that's going to be bothering her as well. And the camps do let them know that we tend to involve the other support groups and the help groups. So that's not an issue. She specifically mentioned, and they will mention you as a role player, that they don't want their friends or the peer group or their parents or their siblings to be involved, which is completely understandable. And you just reassure them that that's fine. We'll be keeping that confidential.
And another thing which I've written down is, um, if you think there's someone whom you think might hurt you, then the CAMS team will alert the relevant people and make sure, they have made measures to keep you safe. Like, make measures to alert your parent, police, or social services, or, a doctor, your GP, things like that. So if someone's cyberbullying, or is abusing her, you can make arrangements. If you think there's someone if you think there's someone who might hurt you, just let the CAMS team know. They will alert the relevant people. Is that okay? That's also something good which you can add. Yeah.
Yeah, so I would suggest that if you do get this recording, just go back and listen to Dr. Saleh's point. That is a broad and basic outline of how to carry out the discussion. So, and then just going to the scoring card again, the domain where you did good was listening, and you didn't use any jargon. That was good, and you allowed the opportunity to speak. But again, managing concerns, identifying, and as you can see here, these aspects were lacking, and minimal checking of knowledge. So you have to check that as well. And
yeah, that
yeah, so the broad aspect is check concerns, address those concerns, and then you move on to you bring the idea, which in this case it was the CAMS. Explain what is CAMS and check their understanding. Then move on to the next section where if she contests, if she challenges, address those challenges. And then you bring the idea of confidentiality, you bring the idea of signposting, you bring the idea of support group. And this is how most of the communication, this is the backbone of the conversation technique in most of the communication. You have to be aware of different support groups in different scenarios. For example, you have respiratory, diabetes, and all those specialist nurses, and there's a specific team for that.
Yeah, CAMS nurse,
Yeah,
specialist nurse.
CAMS nurse as well. So and with the specifically with the teenagers, uh, a good idea to have a chat with them is not to give them the not to tell them that you have to get this done. They don't like the idea of being ordered. They want to feel empowered. So a good idea is to use a third person analogy, that a lot of teenagers do get benefit from these camps input, and
Yes.
do you think you'd be able to get the benefit? So then that puts them in the chair that they are making the decision. You understand?
yeah.
So yeah, for any of the challenging discussions, for example, if you had any other thing, so you try to bring it as a third person scenario, that a lot of patients, a lot of teenagers, a lot of young adults like you benefit from this kind of services, and I just I hope that it might benefit you as well. What do you think? And then that's more better than telling them, so you need CAMS assessment, and this is going to benefit. This is what you need, versus putting it this way around. Did you
Correct.
get that?
Yeah.
Yeah. So try to make bullet points and points of these things and practice accordingly. Okay.
Yeah, you can jot things down, like revisit this video again, and then sometimes, because I've jotted this down. because when I came to know about the scenario, I started writing things down. Because if it, going blindly to a station like this and not addressing all these issues, they will, and these examiners will be very strict when it comes to these scenarios. Like this is what they basically want to know: are you a good enough registrar who can communicate really well in a situation like this? Even the what I say, even the English candidates also find it hard sometimes, to address how to address a teenager like this. So they will assess you. There's a limit to how much they can assess you in a clinical station, but they will be really strict in the development, communication, and history taking
Yeah.
stations.
And whether they make it official or not, but there is a negative marking in this station particularly compared to other stations, and that negative marking is using jargons, providing inaccurate informations. So even if you're doing really well, but if you've done these mistakes, you will lose marks.
I what do you say? When I lost my first exam, right? Communication was like, what is there in communication? I felt like, I'm okay in communication. I can speak really well. But when I came to know, I got only half marks out of the full marks. I was like, what the hell? What kind of exam is this? But then I came to know they have reasons why they're cutting marks or haven't put marks. You know, this key card which Raisbai has shown, right? That basically tells you what exactly, why are they not putting marks, and why are they not giving us full marks. So
Yeah.
for me,
You,
it is written in the feedback. This doctor's body language was not good. I was like, seriously, what is there in my body language? Yeah,
yeah,
and
your tone, your body
yeah,
language, and everything. They assess everything, and you don't realize where you lose marks. You think you might have done good, but this is how communication station is.
this exam, sometimes literally demoralizes you when especially for me, who was I've like failed twice during COVID station. So I was like, communication, what is there to prepare in the station? But there are certain elements in which how you speak and things of that sort. And when they in the feedback, you will come to know why they basically have cut down marks or not put marks for you. So yes, that's why we thought of discussing this station. Yeah, hope it's been helpful for you guys.
Yes, yes, it was. It was very helpful.
And you can I had listed down some phrase instead of repeatedly using I understand. I had listed out I realize, I can see where you're coming from, I get your point. So so that I'm not repeating myself over and over again. And also I think Harshada, you had apologized quite a few times, which was
Yeah,
not
so
required in this station.
yeah, but then again, I feel Harshada did okay. But these things, why? I just we just wanted you to highlight these stations, like these facts, in these scenarios, like what to concentrate on, uh, especially when you're doing a session like this where you're not literally seeing someone's face, you're not seeing the teenager's face, you're literally imagining there's a teenager. But in
Mm.
the real station, there will be a teenager, and you have to assess how, uh,
Yeah,
yeah,
yeah.
she replies back to you and things of that sort. I, as a teenager, have acted really very bad, but some teenagers will throw a tantrum in the station. So
Yeah.
just be careful, okay? So,
Yeah, your
but
your tone and your
yeah, it was very good. Yeah.
that was really nice. Your
Yeah.
empathy and your sympathizing and those things were really nice. But just be mindful of these points that we highlighted, uh,
Sorry, did you say
because
that I should not apologize? I didn't get the last bit. You said I shouldn't have apologized.
no. I mean, you might have not realized, but I was counting the number of times you were saying, I'm sorry, I'm sorry," and that was slightly. It seemed as
Yeah.
if it was a bit over repetitive.
Okay, okay.
Yeah.
Just say that, Chloe, I can literally understand what kind of a situation you are in, like that, or, I appreciate, you're really stressed out, you're mentally in complete breakdown. I say you just need to, shuffle your words and play around with
Yeah.
the words. Yeah. Just
Yeah.
show that,
Try to make a list of these kind of phrases,
Phrases.
yeah,
because this is where you I mean, especially we non-native English speakers, we fall short, and we tend to be repetitive over and over again.
And then you can say, unfortunately, this is not the policy of the hospital. We are, I really, I'm quite sorry that you're not being able to go home. I understand that you wanna. It's summertime and you wanna go out and it's a jolly time. You wanna have a jovial time with your friends. ऐसे बोल के you have to, yeah, yeah.
Sure.
Okay. Good. Yeah, the children's playroom have billiards, like snooker, a lot of things in there, like PlayStation.
PlayStation and
Yeah.
Xbox and all the facilities they
Yeah,
have.
you can tell them that if you are really bored or you just let us know. We can make arrangements for you. We can watch a DVD or kill time by doing this and that, and yeah.
Even for safeguarding reasons, we keep children for like good 4 5 days, and they're all alone. Their parents think that they are not safe at home, so they don't want to take them home. So it's like kind of we have seen those kids. Oh God,
Yeah.
very difficult for them. Yet they somehow survive those days.
Yeah, they have done all sorts of stuff in their
And
life. Yeah.
they started playing in the ward.
I mean, they're all alone all the
All the
time.
nurses were so much like angry. And
Mhm.
Yeah, I think we just better avoid going into that discussion. I'll have to again edit the video.
yeah,
Sorry.
sure.
Yeah.
Mm.
Yeah. So,
Okay.
so few of the phrases I had listed down. You can take your pick, or you can put that all, and you can see what suits in which scenario. Was like I'm aware of, or to be aware of. I realize, I recognize, I see your point. That's fair enough. I see what you mean. I acknowledge. I am certain, and I appreciate. So that this is all the synonyms of I understand.
Okay.
Okay. So this was quite
आपने इतना
helpful.
जल्दी बोल दिए.
No,
वो
I will give a
sorry.
I'll send you guys a screenshot of this one. But
Okay.
I found this really helpful.
I have a question. The marking sheet that you were showing us, is it for every station or it is just for the communication?
That's specifically communication station. Two marks
Okay.
on those
And
four
how
domains.
much is the passing? How much is the passing?
Eight marks you have in that station.
Hmm.
And you have got like four domains. So it's two marks in each domain. And you tend to lose marks very easily if you become sloppy in any of the areas. And the examiners are quite slick about, quite subtle about taking away your marks in the communication station.
I don't understand. Some people also, like one of our colleagues, she has got just like full marks. Just 1 mark was less. I don't know, 78 out of 79. Nita, I think. I don't understand like how one can get this much marks in the exam.
I've seen people getting near almost 82 out of 82, and then 1 or 2 marks short. Some
Yeah.
examiners are quite generous. They see the candidate is really good enough. They ignore a lot of mistakes. But in the practice sessions, as we are doing here, we can't be generous because that will be misleading
Okay.
to you guys. Yeah.
No, that's okay. But I was like amazed. And like out of total, how much is the passing marks?
See, it's not like that. Imagine you scored really bad in the station. Okay,
Mm-hmm.
you scored really bad in the station, but you did very well in all of the stations. You will
Mm-hmm.
pass. It's not like you need to have minimum marks in every
But
station.
someone told that one should have 80% of.
No, no, no,
Yeah.
no.
As a general rule, if you lose two stations, you lose the exam.
Okay.
I mean, you have to literally do really bad, and yeah, you guys won't do that bad.
Okay. I hope
Yeah.
so. What are the total marks you say again? Out of
Sorry.
how many marks is it, the entire exam?
I think it's 83.
Okay.
It was different in the COVID adapted, and it's different slightly different in the face-to-face clinical one.
I've heard that development has the maximum marks.
Yeah, development. It's not like herd. It is the maximum marks.
Oh, so
Development
what
is the longest station,
can you
and
tell the mark?
carries.
Yeah, the marking for each station.
Sorry.
Can you repeat the marking for each station?
So the clinical stations have, uh, I think, 8 marks, and the development station carries around 13 marks, and the video station carries, I think, 6 marks. So yeah, we just add up those things because I remember the format in the COVID adapted one. There was a development station which was I mean the long station, and then there was a long case discussion. So there were two long case discussion cases. So development plus two long cases, three major stations carried 13 marks. So they have just changed it. I'll have a look at it and I'll confirm you guys. But the short clinical ones are 8 marks. Video is 6 marks. Communication is again 8 marks. So
And history?
history taking is, I think, 10 marks or something.
Okay.
The highest is development. Then you have the history taking, history and management, and then you have the clinical ones, short clinical ones.
Okay. Yeah, history has 10 marks.
Okay. It's 11:30 now.
Yeah, I'll have to leave. I'll just send off this scan.
Yeah. Are you guys tired? Should we wind up, or we can do tomorrow, or should we do one more? Hello.
किसी की आवाज नहीं आ रही है.
I mean, Harshada, please don't be what do you say? Don't be sad or anything like this. Be
Yeah,
be-
please don't take this personal.
yeah,
Absolutely not.
yeah.
I'm just,
Don't worry.
everybody's silent. Nobody wants to do
See,
it. So I was
me.
just laughing over that.
Yeah, even me and Rais bhai are just trying to keep the standards really high because I don't know how the exams are in Dubai, Middle East or India and all, but in England, in this country, right, they freaking have a very high standard, okay, and most of our competitors we are doing this
Doing that.
exam with ST trainees, right?
Yeah.
They've done their med school in this country. They know properly to handle any situation. So we are competing against what do you say, those trainees. So I feel you need to there's a standard key which we need to get just to show at least we are par with them. And that holds a good value in this exam, and that's why we try to be a little strict now, because if you take this lightly and I've taken this exam lightly when I started off, and I've like paid for it.
Yeah. I've sent a scan document of my little note. You can have a look. I'll probably just end the meeting now because I have got
Yeah.
I'm on work tomorrow.
Yeah, fine.
Okay.
So are you guys free tomorrow? We can do one session tomorrow then. Is that okay?
Can you do it like in the late hours because I'm having long day tomorrow and day after tomorrow.
Yeah. If Harshida wants and Dr. Maham wants it in the daytime, I can do daytime for you guys, and for Myra and
Yes,
Amita in the nighttime.
done.
I
Okay.
can do the night
Yes,
because
done.
tomorrow I have a birthday party to attend. So
Okay.
I will.
Okay. So then shall we do it in the nighttime if everyone wants it in the nighttime?
Yeah. Just, okay.
Or
Okay, that's great.
one on one, yeah, or one on one. Just let me know how you want this.
And what are we doing tomorrow?
Tomorrow it won't be Harshada presenting. Someone else
No,
will present.
but what is it? History or communication or what is it?
What do you guys want? Where are you? Where do you think you guys are lagging, or you want to be more confident?
I think we should do two stations, one communication and one development or history, whatever.
Okay. Yeah. So is that okay with everyone?
History and development. Yeah, that's fine. History is fine. Yeah. Development, I'm just trying to learn those. I mean, I'm not
Yeah,
sure.
myself and Saleh, whenever we get time together, we'll put forward a demonstration of assessment of the, I mean, assessment of the station, or assessment of a domain, particular domain. We won't be doing the history bits because I think you guys are well versed with history, how to take the history, and but in terms of how to describe the assessment of a particular domain, we'll try to come up with that. Okay.
Yeah, that's fine.
Yeah.
Dr. Rais, when will we do the clinical scenarios? I mean, we haven't done CVS and respiratory we did, ophthalmology we did. I mean, I examined it.
Yes.
Cranial nerves we did as well, but I think some we need to do still. So just for
Yeah.
a
Yeah.
thorough,
Fine. So
yeah,
we'll plan out a time and we'll address those the common ones, which is 100%, which will be there in the exam, which is the CVS, RS, abdomen, and then the uncommon ones can be like examination of the neck and musculoskeletal examination of the joint,
Hmm.
and yeah, and then lower limb neurology or upper limb neurology.
Yeah, okay, okay.
Okay.
Okay,
Fine.
then let's wind up. Yeah, we can
Yeah, thank
Okay.
you so much. Thank you. It was very helpful. Goodbye.
rest
Okay.
of
Thank
the day.
Bye. Bye.
Prepare well.
you.
Yeah,
Thank you.
inshallah.
Thank you.
Bye.
मतलब आपस में प्रैक्टिस करना शुरू करें ताकि हमारी थोड़ी वर्बलाइजेशन हो यार। तो समझ नहीं आ रहा है, मैं जब भी क्लास लेती हूँ मुझे लगता है कि दिमाग में हमें बातें सारी होती हैं लेकिन हमें बोलना नहीं आती है। तो आई थिंक वी शुड बी प्रैक्टिसिंग मोर।
हाँ वालेकुम अस्सलाम जी मायरा।
हाँ मैंने कहा कम्युनिकेशन यार कल से प्रैक्टिस करते हैं, भले एक ही सही, लेकिन हमें करना है, नहीं तो हमारे बुक से नहीं है लफ्ज निकलेंगे, मैं बता रही हूँ।
हाँ नहीं निकलेंगे यार, और मुझे ये हो रहा था कि हमने ये लिया था प्रोग्राम कि हम लोगों की ज्यादा प्रैक्टिस होगी। अब वो यही बात है कि अब इतने लोग आ गए, चलो एक दो लोग होते फिर, अब इतने ज्यादा लोग आ गए कि फिर अब उनको अगर हमने सुनना ही है तो फिर हम खुद अपनी गलतियां कब जज करवाएंगे। इन लोगों को इतने सारे लोग नहीं लेने चाहिए थे ना उसमें, या तो
यार
फिर
लेकिन एक चीज है, आई डोंट नो, आप सही कह रही हैं, आप बिल्कुल सही कह रही हैं। कल हमारे